Welcome back to a Long COVID Doctor, an educational series for Long COVID sufferers. I'm Dr. Tim Robinson, formerly a family doctor, GP for 30 years, now working in Long COVID Services for 5 years. I post on all the usual podcast channels and also on YouTube. I hope you find them helpful. If you do, click subscribe, spread the word. Just to say there's no conflict of interest here. I do this for free. I'm not gaining anything financially. My reward is helping those who are still suffering from long COVID. So, thanks for all the feedback that you send me. Apologies for no replies. I just don't have the time. I'm sorry about that. I read them, of course, and I appreciate them because they help me with my future postings. So please keep them coming. Another apology, my usual disclaimer. It's important, obviously. Any advice or treatment that I mention in these podcasts or in the YouTube postings should only be considered after talking to your own doctor. Let's keep safe. So this is a talk all about going hot and cold in long COVID. And I will cover the symptoms, the causes of going hot and cold in long COVID, and the strategies and how we can help. So here we go. Hot and cold in long COVID. It's quite common and it's quite a frequently reported symptom, certainly in the clinics that I work in, especially cold intolerance, that feeling of, deep in the core, in your bones, cold and shiveriness. So, what are we talking about here? What is hot and cold, going hot and cold? Basically, it's something called temperature dysregulation. That's the fancy medical term for it, temperature dysregulation. That's that subjective feeling of either feeling too hot or too cold, or either hot or cold, alternating. So that is a general feeling, so deep inside your core, or peripherally, i.e. your feet, your hands. So what do you get? Why do we get hot and cold? What is temperature regulation? How is it regulated? How's your body temperature regulated? Basically, heat is generated in our body, in every cell of our body, by metabolic processes, the metabolism within cells, those chemical processes. The energy molecule ATP is converted to ADP in order to bring about energy release, but it also brings about heat. That heat within the body is controlled by the brain, the thermoregulatory center in the brain stem. So, question, why do we get hot and cold? Why is that control of temperature malfunctioning? So basically, the brainstem connects with, the brainstem, as I said, is where the temperature regulatory center is in the brain. It connects with the autonomic nervous system, the sympathetic and the parasympathetic nervous systems. It sends nerve signals from that center, those centers in the brain, to blood vessels around the body, the skin, the hands, the feet, all throughout the body. The sympathetic nervous system, that is the fight and flight nervous system, the adrenaline system, brings about blood vessel constriction, narrowing. And so basically blood is channeled and retained more in the actual the core of the body, the center of the body, and hence heat is conserved. The other part of the the autonomic nervous system is the parasympathetic nervous system, the rest and digest, in inverted commas, part of the autonomic nervous system. The parasympathetic nervous system brings about blood vessel dilation. That's opening up, okay? Opening up to the peripheries, to the skin, to the hands, to the legs, to the feet, i.e., heat is lost. In the extreme cold situations, the sympathetic nervous system really works hard, and it tells the muscles to start to contract and relax, and that is called shivering. The shivering process generates more heat. So when the sympathetic nervous system is working hard and, in cold situations, it actually generates more heat that more than you would make naturally with those cellular metabolic processes. Well, so what are our patients telling us? How does, temperature dysregulation, going hot, going cold, present? Well, basically, as I say, you may feel, permanently overheating, or you may feel permanently chilled to the bone, really cold, or, like I said earlier, alternating, going hot, then cold, and not really, having any control. So when patients tell us they feel the cold, that may be only in the hands and the feet. However, it may well be deep within the core, in the heart of the body, if you like. And there may be associated shivering, teeth chattering. There may be skin color changes, the skin going white or even blue, going sort of mottled. Patients are often saying they just, have to, in order to deal with that deep cold in the core, sensation, they have to put on multiple layers or wear gloves and extra socks, a hat indoors. These sort of stories are told to us by our patients. Equally, for those patients who really can't tolerate the heat and feel permanently roasting hot, that may be, continuous, or it may be that it's coming in waves, sort of flushing. Again, it may be only in the peripheries. Their hands are roasting and sweaty all the time, likewise feet. Or it may be their whole body feels like it's roasting. It's an oven. There may be associated skin tingling or sort of a crawling sensation on the actual skin. There may be associated sweating. There may be, again, color changes, but not going cold, not going pale white, as in the cold, excessive cold feelings, going flushed, red, puce, which in itself can be really embarrassing. These temperature swings, hot temperature swings can occur any time, be it day or night. Often patients, say that they get flushing, particularly at night. And for a lot of the female patients, they very reasonably ask whether, they are developing their menopause well before the expected time of like 45 to 55, in their 30s. We've had patients who have said, is my menopause coming early? So, yes, we're dealing with patients who are long COVID sufferers, but are there other causes for being cold, feeling cold, or having that chilliness, that core, right in the heart, in your bones, cold. Are there medical reasons for that? Well, yes, there are. And we break them down to central reasons and peripheral reasons. So, central reasons for feeling very cold is the heat production in our cells is reduced because our metabolic rate is reduced. For example, in underactive thyroid gland, hypothyroidism, but also in low basal body mass index. So being underweight or frailty, these can all lead to reduced heat production. If you've got reduced heat production, you're going to feel cold. Makes sense. The other central reasons for feeling cold is that the heat regulation center in the brain stem, the thermoregulatory center, as it's known as, can be malfunctioning. That's dysfunction of the autonomic nervous system for whatever reason, and there are a number of reasons. Another central cause for medical reason for feeling cold is anemia. You may be anemic. And when you're anemic, there's less oxygen being carried around to the body, less oxygen going into the cells, less metabolism, less heat generated. So those are all the central reasons for feeling cold. Peripheral reasons could be due to a condition called Raynaud's disease, Raynaud's phenomenon, Raynaud's syndrome, that in the hands and the feet, mostly presenting with hands, where the blood vessels, the mini blood vessels, the small blood vessels that serve your digits, your hands, your fingers, go into spasm. And when they go into spasm, if they go into spasm, they vasoconstrict, they narrow. Therefore, there's less blood going to your fingers. And characteristically, in Raynaud's syndrome, your fingers can go through a range of colors: white, blue, crimson, and then rotating. Okay, and then back to normal, and then triggers off again. So that's Raynaud's disease. Another cause peripherally for feeling cold is peripheral neuropathy. So malfunction of the peripheral nerves to the skin, to the hands and feet. And that can happen in diabetes. So those are the reasons for feeling cold, medical reasons. The medical reasons for feeling hot, So therefore, there are central reasons again. It's sort of increased heat production. When do you get increased heat production? When the metabolic rate is increased, and that could be due to overactivity of the thyroid. So hyperthyroidism or thyrotoxicosis. Also in fevers, but obviously this isn't really relevant in long COVID because your acute fever associated with your acute COVID illness, with your SARS-CoV-2 virus, your COVID virus, has passed and you're now in the long COVID phase. So, fever is probably not relevant, but, it's a reminder to you that if you do have a fever, then that can cause temperature regulation. That's why you go hot and sweaty when you're having when you've got flu, simple influenza. Again, like another central reasons for feeling too hot is, again, not dissimilar to feeling cold centrally, and that is problem with the brainstem. So again, dysfunction of the autonomic nervous system for whatever reason. There are a number of reasons why you may have a problem in the brainstem. And then finally, medical reason, menopause. Again, I've talked about this a little bit a few moments ago. And as I said, a lot of young ladies will come to us saying, is my menopause come early? Well, we know that menopause causes, hot flushes and night sweats. So perhaps that is the reason if you are having hot and cold flushes. And what I mean is, so hot and cold flushes, and so in other words, you may actually have menopause happening as well as the hot and cold that is happening with your long COVID. You may have going hot and cold, flushing and sweating for both reasons. And obviously, if you're menopausal and you've got menopausal hot sweats, etc., that obviously will compound the difficulties you're having with temperature regulation. Okay, so that sort of covers the medical reasons why someone might be presenting with excessive heat or excessive cold. Okay, but what about long COVID now? Why are people getting excessive heat and cold in long COVID? Well, again, as always, we've got to turn back to what we know about long COVID, the causes of long COVID. And basically, it's the excessive dysregulated inflammatory process, the dysregulated immune processes, the mast cell activation that can happen along with dysregulated innate immune system. Other causes, as we know, are microclots occurring in the small blood vessels, also autoantibodies, those when the immune system starts to attack our own normal cells. So these effects in long COVID are throughout the body. Temperature dysregulation in long COVID, therefore, is due to these effects bringing about dysfunction of the autonomic nervous system. So the brainstem, where the thermoregulatory center is, has its set points. And those set points are going to be disrupted for set points for the temperature range, normal temperature range, upset because of that, the effect of long COVID, the inflammation in microclots, etc., are having directly on the brainstem. If that happens, then the connections within the autonomic nervous system, the sympathetic parasympathetic nervous system, are then going to be upset. Also in long COVID, the effects on the blood vessels are the blood vessels that are serving the hands and the legs and the skin are going to become out of control, losing their normal fine-tuning of when a blood vessel should be narrowed, when it should be opened up. So that is lost. Another effect is the phenomenon called small fiber neuropathy. And that could be due to blood clots or could be due to autoantibodies in the tissues. So the small fiber neuropathy is the small fibers, those 4 small nerve fibers are really important for controlling the blood vessels that serve the skin and the peripheries. And if those small nerve fibers are damaged, disrupted, or starved of oxygen because of microclots or antibodies are attacking them, then the fine control of temperature regulation through flow of blood vessels in those flow of blood through those mini blood vessels is going to be interrupted. So that's going to cause temperature dysregulation because those small peripheral blood vessels don't work properly. Also in long COVID, obviously, dysfunction of the inflammatory control. There's release of those cytokines, those inflammatory mediators affect the brainstem, and then that brings about something called the sickness behavior response. Also, the excessive inflammatory process leads to mast cell activation, and then that in itself interferes with the normal control of the blood vessel function. In reality, what's happening, I think that we can probably be pretty sure that it's actually not just one of those many processes. It's probably, in long COVID, a number of those processes happening at the same time, each contributing to some form of dysfunction of the normal tissues, the blood vessels, the nerves, the functioning of the cells, all of them leading to and contributing to temperature dysregulation in long COVID. So it's complicated. And so why have I spent so long explaining it? Well, I think I've done that because actually it's really important to understand the causes of hot and cold in long COVID. It's, basically what I've pointed out here is that it's due to a physical effect. Okay. And that helps us with the self-belief and validation to tell others, I'm having my flushes, or I'm going cold and chilly and shivering, or I'm wearing a hat indoors, because I've got long COVID, heat, thermoregulatory heat, dysfunction. So those are the reasons why I've really gone into the importance of knowing why you are going hot and cold. So what should we do about it? Basically you've got this symptom, one of the many symptoms of long COVID, but this is, let's say it is the thing that is troubling you most. What do you do about it? Well, obviously, as always, if it's something that's troubling you, it's a new problem, you visit your doctor and run it past your doctor. Don't suffer in silence. And the doctor will take the medical history, find out all about the symptoms, the whole story and what impact they're having on you. And, if, the symptoms are suggestive of, a medical condition, the doctor may want to do a medical, physical examination, may want to do some blood tests. So, it's standard medical procedure. So, it is a case of ruling out those physical reasons for hot and cold, those medical reasons as I sort of group them under. So thyroid, okay. So is it overactive or is it underactive? So the doctor will want to do a thyroid function test. Are you feeling cold because you're anemic? So again, the doctor will be wanting to do a full blood picture, looking for your hemoglobin level and make sure that you are, you've got enough iron on board, and in your blood cells, to make sure that you're not feeling cold because of anemia. Like I said, temperature dysregulation can be due to peripheral neuropathy, damage of the nerves of the periphery, and the commonest cause for that is diabetes. So the doctor wanting to do a blood test to look for diabetes. So a fasting blood test, blood sugar, as well as something called an HbA1c that looks at your sugar control over the previous 3 months. I've talked about, going hot and cold and flushing and, women suspecting they might have early menopause. Well, I think needs to be excluded. So that's easily done in general practice. Blood test needs to be done to look at the hormone profile, the sex hormone levels of the LH and the FSH. So basically a high LH and FSH will be indicative of early, or will be indicative of menopause. And goes with that is the low estrogen level, estradiol level. So if you have a high LH and FSH and a low estradiol level, you can say, look, you've got menopause. You're menopausal. And what comes commonly with menopause is flushing hot and cold. So therefore, that in itself justifies treatment with HRT. There is another blood test that the doctor may request, and that is something called the free androgen index. And this is due to low testosterone, which can happen in males and females, and that leads to fatigue. Obviously not good, because you're already fatigued from your long COVID. Also low libido. So these symptoms are important to take into account when you're thinking about the whole menopausal picture, because again, if it is that you are menopausal, you will probably benefit from HRT. So, as well as some testosterone. So there we go. Those are the sort of what the doctor will probably be looking for to exclude those medical reasons for going hot and cold. Like I said, if you do have low thyroid, you're going to need levothyroxine. If you've got high thyroid, you're going to need carbimazole. I took the anemia side. Those blood tests will lead to questions. Why have you got anemia? Well, it's probably, it may well be due to diet, or hold on, it may be due to blood loss that you don't know that you are losing. So that in itself warrants investigations to exclude any other underlying sinister causes, bleeding from the bowel, for example. If diabetes has been identified, then obviously you need treatment for that. If you've got peripheral neuropathy as a result of diabetes, you're going to need referral onto neurology. I talked about a peripheral cause for feeling cold, Raynaud's syndrome, where your hands, like I said, are going white and then blue and then sort of purpley mottled, crimson. There are medications that help this problem. So they are a group of drugs called calcium antagonists. Nifedipine is the one that's most commonly used. So how else can we manage being hot and cold? Well, it's as long as all those medical conditions have been looked for and treated if they are present, then really it only comes down to coping with your feeling cold, and that is multiple layers, hand warmers, thermals, and heating in the house. So in a way, that's just common sense. Once we've sort of addressed the medical side and how to manage it, how are we going to manage just thermo-dysregulation, hot and cold in long COVID? How are we going to do that? Well, it's annoying, unfortunate, but actually there are no specific treatments that are going to heat you up or cool you down in long COVID. No specific treatments to actually, like I say, turn up the dial or turn it down. There are no specific treatments, as we know, for the root causes of long COVID. All those multiple causes that I outlined earlier, the immune problems, the inflammatory problems, the microclots problems. There's no specific treatment that will address all those underlying causes that we're all familiar with now of long COVID. Those symptoms, the symptoms here of hot and cold, will generally gradually settle with time. And indeed, this is what our patients are telling us in our clinics, that with time, things settle. So, inflammation does calm with time. Autoantibodies clear with time. As that inflammation subsides, mast cell activation, well, we can treat that, can't we? We can treat that with H1 and H2 blockers. Those blood vessels that are blocked with the microclots will sooner or later be cleared of the clot through the natural process of what we call recanalization, clot clearance, or new blood vessels bypass those microclot blockages. Dysautonomia hopefully settles with time, along with all those other natural recovery processes in long COVID. Damaged nerves. I talked about the small fiber neuropathy, the nerves, both in the peripheries, but also centrally, will sooner or later be repaired, replaced, or new nerves will be created, which then connect through the process of neuroplasticity, which we're all familiar with now. But basically, all in all, it all takes time. And that's long COVID, and that's why it's called long COVID, because it takes a long time. How are we going to speed it up? How are we going to speed up that long COVID recovery? I think in this, what we've got to do is remember again that bigger picture for long COVID recovery. That is, energy management. We've got to be careful of our energy resources. Conserve it if we can, not to overuse it. And so remember the 3 Ps that I've talked about in other presentations. The 3 Ps meaning basically prioritization, planning, and pacing. And just looking after your energy usage, not to overdo it, and certainly not to lead into post-exertional malaise. Gentle reconditioning is important, and doing a bit of movement, again, not too much. Don't forget your pacing. So gentle reconditioning, stretching of those ligaments, those tendons, those muscles, with maybe some gentle yoga. Diet, the mixed balanced diet, really important for umpteen reasons. Not forgetting the gut microbiota. Get my teeth in here. Gut microbiota, the mixed balanced diet. Sleep's really important as part of that whole long COVID recovery. So sleep hygiene, remember, make sure it's a quiet bedroom, make sure it's a dark bedroom, make sure you're comfortable, make sure the temperature's right, not too hot, not too cold. And then remember stress. We've got to address stress to help with that long COVID recovery. Focus, with mindfulness or meditation, or, just a good walk in the countryside, just to calm down and focus on now, not to worry about the past, not to worry about the future. And then finally, social connection, really important for long COVID recovery. Connecting with people, being occupied, have an interest. So those are, as I say, the key components for recovery from long COVID and the restoration of your well-being. So there it is. That's my sort of update on going hot and cold, temperature dysregulation in long COVID. I hope you found it helpful. And I hope you now understand, what underlies that temperature dysregulation, and you know the medical causes, which obviously need to be excluded. Go to your doctor with any new symptom, including going hot and cold. As always, this is just an educational series for you long COVID sufferers. Don't forget my unusual disclaimer, and that is any advice or treatment that I've mentioned, discuss it with your doctor. Remember, safety first. So, hope you found that helpful. And if you have, obviously, click subscribe and spread the word to anyone else that you know who has long COVID. May help them as well. As before, thanks again for all the feedback that you send in, either on YouTube or podcasts. Again, apologies. I just haven't got time to reply to all your comments or your queries. I wish I did, because I know that there's a big demand for that. But keep them coming in all the same, because they help me with my future postings. So in the meantime, I wish you well with your long COVID recovery, and I look forward to the next update that I will be posting in a couple of weeks' time. All the very best.